Hi there. My name is Shubha Swami, and I'm a licensed professional counselor here in Georgia, and I have a private practice in East Cobb. So I was doing a live broadcast yesterday evening for Georgia Postpartum Support International, and we had a lot of technical difficulties with visual, so I'm trying to do this again, and hopefully this comes out better and information can come across, and I come across to you all. I am very happy to talk to you all today about infertility and how it pertains and can be a risk factor for postpartum mood issues. And first of all, I just wanted to define infertility, that it is anytime an individual or couple is trying to conceive naturally for 12 months or more and are unable to get pregnant on their own and or not able to carry to term. So with that in mind, I thought it made sense to first look at the research. You know, what research has been done connecting infertility treatment and postpartum mood issues. And the first piece of research I came across was done by an Australian research team. And they found that after looking at 700 women, that they concluded moms who conceived using assisted reproductive technology, which is ART, which is basically anytime you're using medical science to help you conceive to try and get pregnant. So women using ART are 4 times more likely to have emotional issues during that postpartum period. And specifically, I think they measure to the first 6 weeks after baby. And they did find that there is an associated risk of going through infertility treatment and then later having difficulty and emotional struggles post-baby and with parenting and with their mood. They also found that women who conceived using ART were also more likely to be older, to have multiple births, and to have complicated births resulting in C-section. And those 3 are also risk factors for postpartum mood issues. So it's all kind of going hand in hand. And they suggested that folks who are going through infertility treatment, they really recommend that they seek counseling or some form of support during their pregnancy as well as after, which I think was really a great suggestion and advice, and something I certainly talk about with my folks. And I think it's very valuable to have that support, whatever form you need, but along the whole process. And there was another study done by a Danish team, and they looked at just women who are going through infertility treatments, and they found that women who were able to get pregnant were 5 times more likely to experience some depression after having the baby versus those women who went through infertility treatment were not able to get pregnant at all. Their baseline stayed at a certain level, whereas those who were able to have a baby still dropped and went into some form of depression during that postpartum period. So that was a very interesting result and something they weren't expecting, and it went against their hypothesis. The other study I looked at was done by the Journal of Infertility and Sterility, and they did a study across the US and looked at over 40,000 women, and they did not find any statistically significant results that confirmed a higher incidence of postpartum depression with women who went through infertility. So they didn't find statistically significant results, but they also said they think that the women who went through infertility were far less likely to report to anyone that they were struggling. So this makes a lot of sense to me. I think any of us in the field know that postpartum mood issues in general are very underreported. And it makes sense that it'd be especially underreported amongst those who are going through or who went through infertility treatment, because I think there is this much far greater shame and guilt around it. And I'll speak to that in just a few minutes here. So those are some of the studies that are done and some of the background. And then I thought it made sense to talk a little bit about what puts these women at greater risk? What is it about going through infertility that makes it a risk factor for postpartum mood issues? So first, I think it's important to look at what the couples have been through. They've been through this unbelievable journey right from the beginning. It has been most likely a big surprise that they're unable to conceive. And so they've been trying for at least 1 year, every month, most likely, to try and get pregnant. So every month there is this trying, hoping, waiting, getting that negative test, getting a period, and then that disappointment and that crushing feeling of not again. So they are doing this for at least a year before they're even then getting treatment and starting to see doctors about it. And then it's going to be even longer. So men and women are going through this up and down cycle month after month after month of hope, expectation, and crash. Not to mention that there is disillusionment. This isn't, no one anticipates, most people don't anticipate this being such a hard journey and difficulty. They assume their body is going to do what it's supposed to do. And so there can be a lot of shame and anger with themselves as a man, as a woman, that their body isn't doing this very basic biologic function that most of us take for granted is going to happen. There is this idea of it's supposed to be. It's supposed to be this way. This is how my future is supposed to be. We've got good jobs. We got married. We have the house. Now we're supposed to have our family. And for some, there's just no good reason as to why it's not happening. And that's very difficult to sit with, not knowing. Folks, I have found, especially the longer they've been in this journey of trying to conceive, might be pulling away from their social supports more and more. Usually folks are kind of in this journey with their peers and watching their friends and their coworkers and cousins getting pregnant and having baby showers and first birthday parties can be incredibly difficult and triggering and painful. And folks get tired of answering the same questions of why aren't you pregnant and what are you guys waiting for, or whatever type questions they get. And so to save themselves some of that pain, to insulate a little bit, folks can tend to pull back. And we know that it's important to have your social supports. It's important to have your people and that safety and connection. And so already starting to pull away from that and to get more isolated, is a challenging factor. I think another fact is to think that people assume that everything is just going to be okay. Once they have a baby, once we get pregnant, it's going to be okay. We just need to get to that point. So they're not really thinking and anticipating about the normal adjustments and challenges that come with being a parent and what that does to one's lifestyle, to one's relationship, to one's physical health, all of it. So they're not as maybe prepared because there's such this belief of everything's going to be okay once that positive comes their way. Second, I think it's important to think about pregnancy for folks who've gone through infertility. That for some, they might have a more anxious pregnancy. For someone who's worked, and a couple that's worked so hard, has spent so much money, given so much blood, sweat, and tears to this process and more, they are so invested and so desperate to have a healthy pregnancy. Of course, everybody is, but I think with folks who've gone through infertility, there is even this heightened sense of anxiety and fear with every twinge, with every cramp, with every spotting, with every time they feel the baby or don't feel the baby. It can start to raise those alarm bells of, I hope everything's okay. Because underneath it, they just can't imagine going through all of this again. So you can see it, they're already sort of primed if during pregnancy, after that initial excitement of being pregnant, that there can also be a lot of doubt and fear that's also attached to it. And third, like I said, folks aren't just thinking about the normal adjustments that come with parenting, that most parents are going to have fear and insecurity and doubt and feel like they don't know what they're doing. But I think with folks who've gone through infertility, they don't allow a lot of room for that. And so they might be even more surprised and shocked that they are struggling, that this is really hard, that this is impacting them in ways they never even imagined. So with all that being said, I think you can see how folks are primed, right? They are just overcharged by the time they even get to having that baby in their arms, because there's been so much disillusionment, doubt, unexpectedness, fear, sadness, isolation, loss, potentially. And all of this gets heightened by folks who've gone through infertility and miscarriage. So you can see that, again, they're overcharged and have been overwrought by the time they even get to see that baby for the first time. So what I see with my folks, I would say the most common things I see after they've had the baby is fear and doubt. That's with my folks across the board, postpartum work that I'm doing, but also with folks who are on infertility. I think that is coupled with the fact that all those what if questions that are so normal and such a part of this ride of parenting and this unbelievable task of parenting that we take on, with folks who've gone through infertility, that coupled with their perfectionism, their idealism of what they think they should be and the kind of parent they should be, it's very difficult to hold both. It's very difficult to reconcile. Like, I am freaking out. I don't know if I'm doing all this right. I'm so worried about, are they okay? Are they getting enough to eat? Am I going to keep them safe? What if this happens? What if that happens? With this image of, I'm going to be the best mom or the best dad, and I'm just going to be so in love, and we're going to just do everything together, and I am going to just roll with this experience and just be blissed out. I think that is very, very difficult to hold both, because these parents have sort of set themselves up to be this idealized, unrealistic version of a parent that is always 100% in and engaged and completely just okay with what's going on. Whereas most of us are all walking around trying to figure it out and trying to do the best we can and making mistakes and then trying to learn from them. Also, I think there's a huge gap around understanding that pregnancy is not a cure for infertility. And I think that's a really important point that even, in my work and my study, I am learning and I'm appreciating more that all that sadness and worry and fear and doubt and insecurity and tension that existed before, it doesn't just vanish the second one gets pregnant or one's holding a baby. There are real wounds that were opened up. People have expressed to me that they've changed. They feel like their personality changes when they're in this process of infertility. And so all of that doesn't just get wiped clean because now there's a baby. Hardly, right? And so I think there goes back to what that article was saying. It's still very important for people to get support to really intentionally deal with all those feelings that came up, that they went through during their journey, finding a way to process them, to heal from them so that they can move into parenthood on a much stronger footing. And then the other thing I hear and see so much is guilt. And any parent out there who's watching right now truly knows what I'm talking about. There's even that term of mama guilt. This is, I think, even heightened in this case because people are so afraid to tell. They're so afraid to be honest and say, I'm struggling. I don't want to even hold my baby right now. I can't get out of bed. This is not what I want. I'm just hoping my mom comes and takes the baby and maybe keeps her for a few days. Or I'm terrified to step outside. I don't know how to do this. How could this be what I'm feeling when I wanted this so much? It's so hard to reconcile and make sense of this. And there's almost no room. I think that's the other piece, along with guilt, is that folks who've gone through infertility are so hard on themselves because they feel like, This is what I wanted. How dare I be crying all day? This is not okay. When in fact it is. This is something you're going through. This is not your fault. You're not choosing this experience. So again, it's very disconcerting. It's very disappointing for folks to be feeling this way, and surprising. So this is where friends and family can be really helpful. My hope is that folks who are watching this today, that are aunts and moms and coworkers or siblings, can really just hear about all this and bring it and have a sincere form of support and listening. And remember that listening and understanding must precede advice. Try not to be so quick to fix it or to make it better, because you may not be able to, but you can listen. You can offer support and understanding and say, God, that sounds so hard. What can I do? Do you need me to come over? Do you need me to let you sleep or take a shower? How can I be helpful? And the things that I've heard that are really not so helpful is don't remind that person, no, you should just be so happy. You should be grateful. You got pregnant. You have this beautiful baby. It's okay. This will pass. Because that's already adding to that horrible sense of I shouldn't be feeling this way. They are grateful. They do know they are blessed. And they are feeling this lousy. And they're trying every day, every minute to try and figure out how these two are coexisting. So they don't need to be reminded that they should be grateful. Don't say, oh, at least you have a baby. Kind of like that doesn't make it better. They're still suffering and struggling. Or make a joke or make light of it and say, oh, this is what you wanted. I told you, babies and kids are so much work and they're so hard. And you should have just spent all that money on a really good vacation. You know, not helpful for obvious reasons. So just to end, I wanted to tell you all what I tell my folks over and over again, because I don't think you can hear it enough, is that it's so important to be kind and compassionate and patient with yourself. This is something you're going through. This is not your fault. And it is so difficult to live with. But there is help and there's support and there are resources. And that I really would just encourage folks to just be kind and patient and compassionate and to get help and to know it's not their fault. And that it's so important to nurture who you are, your relationship, and that your life is so much more than just this baby or trying to have this baby, and to continue to nurture all those things that make meaning to you. And remembering that the transition to parenthood is one of the most awesome, biggest things you're going to do. And so you want to begin that phase from a real place of strength and wholeness and wellness, not from a place of depletion and stress and fear. So to be really mindful and cognizant of how you are coming into this phase of life and do what you can to kind of enhance your wellness all along the way, and especially into parenthood. So thank you all so much. I hope this video came out better. And please feel free to post questions. I will be checking, and we'll all be checking from Georgia PSI and responding to questions and thoughts. And please tune in for the next episode, which will be Tuesday, May 8th at 9 o'clock, where the speaker will be speaking on self-care strategies and how important self-care is to your recovery. So super important topic. I hope you'll all tune in. And remember, you are not alone. You are not to blame. And with help, you will be well. Thank you all so much.